Menstrual pain is a common experience for many people who menstruate. For some, it's a mild discomfort, a dull ache that marks the beginning of their period. For others, it's a severe, debilitating pain that interferes with daily life. Understanding what's normal and what may indicate a problem is essential for maintaining your health and well-being. Menstrual pain, also known as dysmenorrhea, typically occurs just before and during the first few days of your period. It usually presents as cramping in the lower abdomen, but it can also radiate to the lower back and thighs. These cramps are caused by the uterus contracting to help shed its lining. The hormone prostaglandin triggers these contractions, and higher levels of prostaglandins are associated with more intense pain. For most people, menstrual cramps are a normal part of the menstrual cycle. They can begin a day or two before bleeding starts and last for 2 to 3 days. The pain is often most intense at the onset and gradually eases as the period progresses. Over-the-counter pain relievers, heating pads, light exercise, and rest often provide effective relief. Some people also find that hormonal birth control methods help reduce the severity of cramps by regulating hormone levels. Normal menstrual pain should be manageable. While it may be uncomfortable, it shouldn't prevent you from participating in your usual activities. If the pain is mild to moderate, responds well to home remedies or simple medications, and lasts only a couple of days, it's likely within the range of normal. However, it's important to recognize when menstrual pain might be a sign of something more serious. Severe pain that doesn't improve with typical treatments, pain that lasts several days, or pain that starts to interfere with work, school, or social life may be abnormal. Additionally, if your cramps suddenly become much worse than usual, or you start experiencing them for the first time after years of relatively pain-free periods, it's a good idea to seek medical advice. One of the most common causes of abnormal menstrual pain is endometriosis. This condition occurs when tissue similar to the lining of the uterus grows outside of the uterus, often on the ovaries, fallopian tubes, or pelvic lining. Endometriosis can cause severe, persistent pain, heavy bleeding, and sometimes pain during intercourse or bowel movement. Another condition, adenomyosis, occurs when the uterine lining grows into the muscle wall of the uterus, also resulting in intense cramps and heavy periods. Uterine fibroids, which are non-cancerous growths in the uterus, can also cause significant menstrual pain and heavy bleeding. Pelvic inflammatory disease, an infection of the reproductive organs, is another possible cause of severe menstrual pain, often accompanied by fever, unusual discharge, or pain during sex. It's also important to consider the timing and nature of your pain. Cramps that occur exclusively during your period are likely due to the normal menstrual process. However, pain that happens at other times in your cycle, such as mid-cycle during ovulation, or pain that persists throughout the month, may point to another underlying issue. In these cases, it's especially important to consult a healthcare provider. There are other symptoms that, when present with menstrual pain, should prompt you to seek medical attention. These include periods that are much heavier or longer than usual, bleeding between periods, unusual vaginal discharge, fever, or sudden severe pelvic pain. These symptoms could indicate infections, hormonal imbalances, or structural issues that require medical evaluation. Diagnosing the cause of abnormal menstrual pain often starts with a thorough medical history and physical exam. Your healthcare provider may ask about the timing, duration, and severity of your pain, as well as any other symptoms you've noticed. They may recommend further testing, such as pelvic ultrasound, MRI, or laparoscopy, to get a clearer picture of what's happening inside your body. Treatment options depend on the underlying cause. For typical menstrual cramps, non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen or naproxen, can help reduce pain and inflammation. Applying heat to the lower abdomen, gentle exercise, and relaxation techniques such as yoga or meditation may also provide relief. If pain is severe or persistent, hormonal treatments such as birth control pills, patches, or intrauterine devices, IUDs, may help by regulating or eliminating periods altogether. For conditions like endometriosis or fibroids, treatment may include hormonal therapy, minimally invasive surgical procedures, or, in some cases, more extensive surgery. Pelvic inflammatory disease requires antibiotics to clear the infection and prevent complications. Your healthcare provider will work with you to develop a treatment plan tailored to your needs. Lifestyle changes can also play a role in managing menstrual pain. Regular physical activity has been shown to decrease the severity of cramps for some people. Maintaining a healthy diet, staying hydrated, and managing stress can all contribute to a more comfortable menstrual experience. Keeping a menstrual diary where you track your symptoms, pain levels, and any changes can be a valuable tool for both you and your healthcare provider in identifying patterns and potential triggers. It's important to remember that you don't have to suffer in silence. Menstrual pain is a common experience, but severe pain is not something you just have to live with. If your periods are interfering with your quality of life, seek help. Open communication with your healthcare provider can lead to an accurate diagnosis and effective treatment so you can regain control over your health and daily activities. Natural ways to relieve menstrual pain. 1. Heat therapy. Heating pads or hot water bottles. Relax. Uterine muscles, warm baths with Epsom salts also help relieve cramping and tension. 2. Herbal remedies. Ginger reduces pain and inflammation. Turmeric, anti-inflammatory and hormone balancing. Chamomile or raspberry leaf tea, calming and uterine soothing. Magnesium relaxes muscles and may reduce prostaglandin production. 3. Exercise light movement increases blood flow and releases endorphins. Try yoga, stretching, or gentle walking, especially during PMS and day 1-2. 4. Dietary adjustments. Avoid processed foods, caffeine, alcohol, and sugar before and during your period. Eat anti-inflammatory foods, leafy greens, berries, fatty fish, nuts. Include omega-3s via supplements or food for hormone balance. 5. Acupressure and massage. Massaging the lower abdomen with lavender or clary sage essential oil may reduce pain. Acupressure point. SP6, San Yin Jiao, on the inner leg, used in TCM for menstrual health. Medical treatments. If natural remedies aren't enough, medical options include 1. NSAIDs, non-steroidal anti-inflammatory drugs. Ibuprofen or naproxen. Reduce prostaglandin production, most effective when taken before pain peaks. 2. Hormonal birth control pills, IUDs, implants, or patches can thin the uterine lining and reduce cramping. Especially helpful for those with endometriosis or fibroids. 3. Prescription medications. For severe dysmenorrhea, stronger pain relief or hormonal therapy may be necessary. Always consult a provider before taking or stopping medications when to see a doctor. See a healthcare provider. If pain is debilitating or worsens with each cycle, pain lasts longer than 2 to 3 days, you experience heavy bleeding, changing a pad and tampon every 1-2 hours, pain occurs outside of menstruation, possible sign of endometriosis, you have difficulty getting pregnant, tips for tracking your pain. Keeping a menstrual diary or app can help. Track when cramps begin and end. Rate pain, 1-10 scale. Log related symptoms, nausea, mood swings, headaches. Identify triggers, diet, stress, exercise. Help your doctor identify possible conditions. In summary, mild to moderate menstrual pain that lasts a few days and responds to simple remedies is usually normal. However, if your pain is severe, persistent, or accompanied by other concerning symptoms, it's important to seek medical advice. Understanding your body and listening to its signals is the first step towards taking charge of your reproductive health. With the right support and treatment, you can find relief and ensure that your menstrual cycle doesn't control your life.